Hello, my name is Chloe Terrio. My question is cupping more effective in reducing blood pressure in patients with hypertension than pharmaceutical therapy? So what is hypertension? Hypertension is defined as abnormally high blood pressure. Normal blood pressure is read as 120/80, so a high blood pressure reading might be 130/120. What is cupping? Cupping therapy is a form of natural medicine in which a local suction is created over the skin using a cup. It has been used in Chinese medicine for decades, and there's virtually no risk of injury. So someone might want to look into a more natural approach to helping alleviate their hypertensive symptoms, because conventional antihypertensive medication does produce adverse side effects. So is cupping more effective in reducing blood pressure in patients with hypertension than pharmaceutical therapy? The idea and hope is that cupping would be at least as effective as pharmaceutical therapy. So the first review is one that looks into the 6 major groups of typical medications that are used in primary care for hypertension. And what they looked at was therapy used as one drug and a combination therapy. And the combination therapy was more effective than one drug on its own. The drugs combined produced an 85% more effective systolic reading, more desirable systolic reading, and a 65% more effective for the diastolic readings. So this establishes that current pharmaceuticals do in fact work. However, sometimes it's important to explore other options of treatment, such as cupping, when we don't know how a patient may react to a certain medication. The next review evaluated the effects of beta blockers compared to placebo and other drugs. They looked at beta blockers as a first-line pharmaceutical therapy for hypertension on mortality and morbidity. And what they found was no significant difference in mortality when compared to other first-line antihypertensive medication. The authors also concluded that most of their outcomes regarding beta blockers as first-line therapy for hypertension have a high risk of being biased. So the unknown of an unnatural treatment such as beta blockers could lead patients to try natural remedies such as cupping. The next review researched the efficacy of conventional antihypertensive medications such as ACE inhibitors and ARBs. What they found was that there was virtually no difference in the all-cause mortality endpoint between the two medications. ACE inhibitors still produce adverse side effects such as cough, and there was actually a higher withdrawal rate of people with the ACE inhibitors compared to the ARBs because of those adverse side effects. So this, in my opinion, paves the way for patients to question the efficacy of their medications compared to other more natural treatments such as cupping. The next review looked at the efficacy of cupping therapy in specific conditions. The therapeutic effect of cupping was compared to no treatment, placebo, and conventional antihypertensive medication. And although more well-designed quality investigations into the efficacy of cupping therapy are needed, there was success in curing a number of individuals with herpes zoster, facial paralysis, acne, and cervical spondylosis through the cupping therapy. And this is promising results for hypersensitive patients who do want that more natural alternative or even a complementary treatment for their condition. The next review looked at wet cupping and its efficacy in treating hypertension. Wet cupping is a form of cupping that just draws blood, and it's been known to be maybe a little bit more effective. So there was one group that received cupping therapy and the conventional antihypertensive medication, and there was one group that received just the medication. And the cupping group saw a decrease in the systolic blood pressure after the 4-week checkup, which was halfway. And after 8 weeks, both groups had basically plateaued. So it is recommended to use cupping as a complementary treatment, but they do recommend further testing to determine if cupping can be effective long term. The next review determines if cupping therapy has an antihypertensive effect on patients who already have hypertension. And there was a notable reduction in the systolic blood pressure, as with the last review, over 3 sessions of wet cupping. But it was not notable for the diastolic blood pressure reading. And it's been recommended that this be a complementary treatment to the already effective conventional antihypertensive medication. So the differences that I found was that each study is just looking for something different. So one is looking for if a certain drug reduced blood pressure, if one reduced it better than another, if cupping is effective at all, if cupping is effective in reducing something with a drug, if it's effective in reducing in hypertensive patients. So it's kind of all over the place, and I don't believe there was enough research on the topic to adequately answer my question. Simply put, cupping is not more effective in treating high blood pressure, but it is effective. So people could use this in conjunction with their traditional medication so that lower doses may be used and the body is less exposed to the possibility of adverse side effects of some of these medications. Future research is required to produce evidence-based practices for cupping and improving hypertension. For example, some more beta blocker subtypes, as well as subtypes of other medications, could be compared to cupping in the long term in future studies. Is there any questions? Thank you.